Okay, we're going to switch gears and talk about healthcare. There's been some interesting things I've been observing that some health organizations want to ban the word patient, and they want to call us consumers, and use that language to get the mindset shift of this kind of orientation around a consumer when delivering healthcare services. And it's kind of consistent with other things. So there's two pretty seminal books that have been published in the last 2 or 3 years that are starting to kind of capture this phenomenon of the consumerization of healthcare. And who is this new patient that will see you now, doctor, instead of the opposite? And then Jane Sarason-Cohn's book that just came out, she's suggesting healthcare consumer is dead, and we're now this health citizen, and she unpacks all that in her tremendous work. And healthcare being usually 10, 15, and then sometimes 25 years behind the rest of the world in modernizing, digital just came on the scene a few years ago. We borrow metaphors from other industries and business models and apply them to our sector to help us kind of catch up with where patients are. And so, pick a startup that comes to me to tell me we're the Uber of this, we're Mollification of healthcare, Amazonification of healthcare, pick a word, it's happening to healthcare. And so I just wonder if we can challenge, is a consumer a patient? So, pick a definition, but the basic tenet is when we're a consumer, we're using our cash to buy things that we want, that meet whatever are our criteria for where we're going to spend that money. And so if a patient is now a consumer, it would suggest then that as patients, we have some kind of purchasing power that will allow us to access healthcare services that meet whatever we're trying to meet. Could be convenience, could be quality, whatever it is, service level, just like we'd buy our iPhone for $2,000 or whatever it is. Well, perhaps in some economies or countries where there is a lot of purchasing power, which is why some of those books have been published, but in Canada, 65 to 70% of all healthcare, and we're now talking formal healthcare, medically necessary services that when the Canada Health Act was enacted, we agreed as a society should be publicly insured with universal access from our taxes. And in Ontario, 50 cents of every dollar you spend on taxes funds our publicly insured healthcare services. So we don't actually have any purchasing power because somebody else is paying. Right? So that kind of falls apart the argument that a consumer is a patient. We can't use power even if we had it to access services because they're already universally available for us and we don't really have a lot of choice. And what's funded by the state, by our taxes, isn't based on meeting our expectations and needs. It's based on what a clinical trial said is the best evidence of good clinical impact, not there to meet your needs. And so, if you unpacked what are the factors that go into a consumer-type purchase, let's just kind of see, can it apply to patients? So the first big one is an orientation around, when you're doing a consumer purchase, it's kind of a happy thing. You're adding something, not a patient. When you're going to go buy your next kind of shoes or your Starbucks latte, you're adding something to your baseline. In healthcare, you're returning to your baseline. Things went out of whack and you want to just get back to your healthy self. Very different starting point. Like I said, when you're a consumer, you pay, and it's your discretionary dollars most of the time. We largely have the public paying, 65%. Of course, your employers, about 15% of healthcare is funded by employers, including a fair share of drugs. If you're under 65 years old. And there's a little thing called me, which is you and I can do a little bit of out-of-pocket purchase for medically necessary services in certain pockets. And it's kind of yellow. There's a little bit, but I don't think it's a drop in the bucket. Power. This is the biggest one. When you're making a consumer purchase, you've got the agency, and you kind of negotiate trust based on whatever way you're going to gather your data. In healthcare, there is no power. It's extremely patriarchal, and that's been 150 years of medicine designed that way, and you've outsourced that power, and maybe that's a great thing, because there's some pretty complicated stuff going on about your biology, and so we've accepted that contract with our care providers. All right, your options, right? I just went to buy my kids some new running shoes. I couldn't handle it at the Foot Locker. I was like, what happened to like the one pair of Nikes I had growing up? Because a core tenet of Canadian healthcare was universal access, irrespective of your ability to pay or your geography, we have a one-size-fits-all paradigm. It has to be that way. And in general, most things that are publicly insured are based on some kind of a clinical trial where they look at the data that worked for the average, and then that means everybody gets what works for the average, which means it doesn't work for anybody, right? I always say, just like when you do a 5K race and everybody gets a double extra large t-shirt, sure, it fits everybody, but it fits nobody. The other big one is of course, the channel to access those services. More and more, although I was astounded by a statistic I just heard that 90% of retail purchases are still done in a store, but the language in the lexicon in consumer is omni-channel, right? In person, phone, digital, whatever it is. We have one channel in healthcare, and it's a clinic or a hospital or a pharmacy. It's bricks and mortar. It's a very institution-centered paradigm. There's a little bit of home. That's what I do. We do 20,000 home visits a day visiting seniors across Canada. That's about 3% of care exchanges in this country. And a little dot called virtual. Believe it or not, less than 0.25% of clinical interactions in this country are done in a non-physical channel, right? There are certain jurisdictions that are at 60%, 70%, which is kind of consistent with what the evidence shows. You don't need an in-person visit for the fair share of healthcare interactions. So we are certainly not omni-channel. And then finally, as I've said, the basis of choice in a consumer interaction is usually price, first and foremost, and then you weigh that against whatever benefits you're trying to get. We have no price option, and we have very little transparency on some variables that would be our choice. So you might be wondering, why the hell did they invite her to this event? Because consumer and healthcare is an oxymoron. The point is, I think just like we've seen, in every other industry, there's a current in the water supply that patients are waking up. There's a revolution happening. We have all the data. We have all the means of production, and we're just not going to take it anymore. And we live a 21st century life in almost all of our interactions in the world, and then we go into a time warp of a 19th century world when we're in healthcare, and it's just not working, and it actually creates bad care when we can't communicate in the channels we're used to in ways that work for our life. And so I'd say I don't think we're ready to replace patient with consumer, but I think there are some really interesting signals, and we're seeing pockets across Canada of courageous organizations that are trying to harness these currents. So unfortunately, this pay one is a non-starter, and the kind of lack of an aspiration around healthcare. You can't be a conscious consumer when you're unconscious, right? It's just how it is. So, that's a big missing piece. Why I this leads me to say we can't ban the word yet, but there are some neat things happening. The whole framing of the word health is changing. The old definition was like absence of disease. I mean, we built medicine to cure you or you died. That was the only options. Now we're staying alive for many years with many diseases. There's a new goal of healthcare. It's not to return you to your baseline. It's to empower you to self-manage in the face of mental illness or a chronic disease. This is a whole new orientation that 150 years of medicine was not designed for. But certain organizations are picking up on this and doing this. Next is who pays. So largely the public pays. We're seeing some really neat innovation globally, and in places like in Alberta and Edmonton, we saw some great stuff. The idea of give patients a budget and say you have to be within what the evidence says your healthcare, will work or not work, but you have some choice with your dollars that makes sense for you. And then, of course, employers more and more are doing this with their health plans, these idea of health spending accounts. Instead of deciding everybody gets 6 massages a year, you decide, do you want a massage or do you want something else? Power, massive change to from provider power to at least what we're calling shared decision making. The idea that you will do better as a patient if you have a joint say in what's going on with your health, your care plan, your medications, your treatments. In the Netherlands, they're moving to 50% of every dollar spent on healthcare in their country will be based on shared decision making. We're at about 0% in Canada. Options, getting there. So what we're starting to see is it's not one size fits all. We're starting to see health organizations at least meet me where my values, my needs, my expectations are. And as digital and kind of AI and good enough stuff comes up, I'm gonna go elsewhere. If I can pay out of pocket and it costs, less to get a doctor visit online than it cost me for my Starbucks latte this morning. And that's already in the market in Canada today. So I think we're gonna start to see some end running of the formal healthcare system if we don't catch up on options. Finally, the channel is moving out of Omni, but to this idea of care anywhere. But we still have this gap of the basis of choice. We don't have price. We're getting a little bit on expectation. And I think as we get more options there to overcome the price and the experience issue, I think we're going to see finally some consumerization-ish of healthcare for patients. Thanks.